Hi, Stefan Hartmann here, Iron Direct Primary Care with Dr. Matthew Tinney of Integrative Medicine at Brevard, and we're going to talk about common nutrients we can order on routine labs. One of the common ones we order is vitamin D, and I like to see my vitamin D above 80. When my patients are above 80, there's evidence to suggest that this lowers their risk of cancer, of heart disease, depression, all of this.
Yeah, diabetes, bone disorders, thyroid's important to have it for that. So, and actually, vitamin D is not even really a vitamin; it's a pro-hormone.
It's a steroid.
So, it's important in just about every cell function. Also, a lot of people think that they can get it from dairy products, which, yeah, there's a little calcium in milk, but there's only 100 units in an 8-ounce glass. So to get 50,000 units, you'd have to drink 500 glasses of milk.
That's too much. You're gonna get so fat off of that.
Yeah, there's no way that's in a day. So that's not possible. Also, the sun can make some. And ancient man did very good with it because he ran around naked and never took a shower. But if we're only exposing our arms and our head, that's only about 18% of our total body surface.
Yeah.
And if you shower within 3 days, you wash most of it off. So you're really not going to get very much from the sun per se. So yeah, I like the 80 range for vitamin D as well too. And if you look at it statistically, where you see risk for cancer, there's a precipitous drop in risk factors when you hit about 65 in that range. You start really seeing a rapid drop, and that peaks out at around 80. So definitely don't want it at 30.
No. Unfortunately, the reference range is way too wide. And most clinics are happy when their patients are at 30, 35, 40.
It's ridiculous.
And they call it a day.
Yeah, we like to actually go so far as to give injections of it. And I mean, some people don't like to take things every day, and that's fine. Vitamin D is fat soluble, so you can, whatever comes out of the bottle, 5,000, 10,000, but you can do it once a week if you'd rather do that.
I also like to add on K2 with the vitamin D I suggest for patients. Why do we like K2?
It's really good for vascular scavenging of plaquing and helps keep the arteries from clogging up.
Precisely.
And I should mention too, the vitamin K, a lot of people get freaked out because they say, oh, it has to do with blood clotting. And to a degree that is true. But when we're talking about increasing your risk for blood clots, it doesn't do that. It's only used to reverse the effects of Coumadin, warfarin, those things. Factors 2, 7, 9, and 10 are vitamin K dependent. So that's only applicable for people that are on anticoagulants of that nature.
Yep. Another common nutrient we'll order is B12 in the blood because it's cheap in order to easy B vitamin to assess. I won't do a full B complex typically, or panel because it's too expensive. But B12, I feel like that's kind of a proxy marker of their overall B complex status.
Yeah. You want to sometimes look at methylmalonic acid too to see how it's functioning. But yeah, B12 is important for carbohydrate metabolism and red blood cell metabolism. It's one of the more common causes of dementia in elderly people. You have to have intrinsic factor in your stomach in order to absorb it further into the small intestine. So all these people that are taking all these acid blockers and these PPIs and all that stuff, they block out your ability to absorb B12. So even taking it sublingually, you're only going to absorb about 20% of it that way. So very important. And if you're going to do it, don't do the cyanocobalamin. Cyano refers to cyanide. Not that it's going to kill you, but it's not as good for you as something like the methyl B12 or the hydroxy B12.
I assume most patients, or 30% of patients, have the mutation for MTHFR. So I just give everyone a methylated B complex.
Right. We don't even use anything else.
Yeah, we don't have that.
There's no point. There's no point.
No. Yeah, the reference range is so wide on B12. It's like 200 up to like 900. But then patients taking a B12, they're worried when they're in the red zone. Like, oh, my B12 is in red, is redline. Is that worrisome?
No. Actually, B12, it's an interesting phenomenon. People say, oh, I want a B12 shot because it gives me a little more energy. And that is true if it's low. But if you're already at 1200 and you do a shot, you're probably not going to notice that much of a difference. But I really do feel like the higher range is going to do you the most good. I mean, it's one of those things that your body stores fairly well as far as B vitamins go, but nonetheless, it's still water soluble. So
Yeah, I've had patients who've had neuropathy or weird nerve things going on. Low B12, give them some B12, goes away.
Interestingly, too, I read a study where B12 used intranasally helped migraine headaches.
Wow.
Don't know.
Well, I've used it in the form of synapsin. So that's NMN, RG3, it's a ginseng extract, and methylcobalamin. And you breathe it right up into the nose. I use it for brain fog and autism. And we've seen some good improvements.
Yeah, actually, I just started somebody on that last week.
Nice.
Yeah. We'll see how he's doing next week.
Yeah. Another common one we order is the iron panel. So iron, total iron binding capacity, and iron itself. Mm-hmm. So I make sure my patients aren't anemic on this, but I also make sure they're not iron overloaded. This is particularly important on my testosterone replacement therapy patients.
Yeah. It's very inflammatory. It increases your risk for cardiovascular disease.
Yeah.
In fact, ferritin and some of those are used as markers for assessing cardiovascular risk.
Yeah, talk more about ferritin. When we see ferritin 300, 400 plus, what's going on there?
Yeah, I mean, it's, just bad metabolism, over-consuming irons, or it can be just part of the whole inflammatory cascade.
Yep. You can get iron deposits on your liver, too. It can cause a liver inflammation. It's not good. A lot of people are using cast iron pans. I think if you overuse cast iron, you can get some metal filings off of that, and it can cause some problems.
I'm sure. Yeah.
And then they're eating a lot of the cereals, and the cereals are fortified with these iron filings. They're factory waste.
Really?
A lot of the times. And you can take a magnet, and you can mash up the cereal, put it in water, and you can take a magnet, and you can find all these iron filings in the cereal.
Make the cereal move around?
Yeah.
Make the little animals in there?
You don't absorb it. You need heme iron. You find that in red meats. You don't need these iron filings.
Right.
Other basic nutrients. What else can we order in a basic panel? You can look at sodium and potassium pretty commonly. I like to look at a good ratio between those.
Right. Those are, basic electrolytes and that kind of stuff.
I find people will often deplete themselves of sodium and potassium because they've been told for years to avoid salt because it'll kill you.
Right.
And they're drinking gallons of water a day, and they show up and they got a potassium of 3. It's like, oh my God.
Which, frankly, that brings up the whole iodine thing too. I didn't know if you had that on there.
I don't have iodine, but we'll talk. Oh, yeah, I do have iodine on there too. That's one you can order.
Yeah. But that's kind of akin, not that they have the same function, but akin to the vitamin D. It's one of those things you should order because people don't eat iodized salt anymore. It's like kosher salt, sea salt, Himalayan salt. None of that stuff has iron in it or iodine.
Yeah, everyone's deficient. This is according to independent research I did here at Iron DPC. I have about 44 patients, and every single one of them, if they're not actively taking exogenous iodine, is between 40, maybe 50 at most, but typically below 40. Yeah. And the reference range there is 40 to 100 on iodine.
Yeah. I was looking at it. My lab says 52 to 100.
Yeah.
So try to get it up around 75, 80.
Yep, that'd be nice. At least.
Yeah.
So that's any other nutrients. I don't order much. You can't really do much on commercial lab testing as far as nutrients go.
No, SpectraCell does a nice panel.
Yeah.
It kind of gives you a 3-month average, but it's it's a little pricey. It's around $400, and
I think it's
not
worth it.
Covered with insurance.
Oh no.
But if you're going to do this kind of thing and you want to have that sort of information in your armamentarium of treatment options, then it's sort of important to know.
I think so, because when we go to a conventional practice, they look at commercial labs, and they're looking at lipids, and they're looking at inflammation, sometimes if you're looking at hormones, but it's based off your nutritional status. All the diseases in medicine, it's not a lack of a pharmaceutical agent, It's a nutrient deficiency.
Yeah, nobody was born with a pharmaceutical deficiency.
No, it's nutrient deficiencies. If you really
Yeah.
want to get to the root of the issue, and if you want to optimize and get maximum performance out of your life, you want to make sure your nutrients are optimized, not just normal.
Right, you got to have the tools.
Optimized. So I think it's worth doing these higher end testing, the SpectraCell or Nutra-Eval test, Genova. You know, a lot of these are $400 minimum, but it's very important, I think.
Yeah, if you can do it, it's definitely worthwhile doing.
Yeah. So that covers nutrients. The next segment will be on hormones.